We go into our final conversation today. We're talking to people who can, who know, who are professionals. I get asked questions about health today. There's some disease or other happening in China. It's been there for a minute. It's not new like that. But are there dangers or implications for other climes? Is it an Africa-bound disease? And also, in the last minute of the conversation, we'll talk a little bit about women, which Nania will be very happy about. Our guest, as always, a super guest, Dr. Teddy Totimeh, consultant neurosurgeon, and he's been unable to take even 2 seconds of rest, and promises that he'll be taking a break in March. We wait and see. Anyway, sir, good morning.
Good morning.
How are you doing? I'm doing
well.
Excellent.
How are you?
I'm alive.
Great, I can see.
Respiratory problems.
Right.
There's been, we've had, of course, the big COVID. Then we discovered during the COVID that, COVID was just one of many respiratory things that was always going on. Now we're hearing about HMPV, which has, again, been sort of mentioned. What is it? And why are we even worried about it?
Well, so HMPV, Human Metapneumovirus, is it's actually very different from COVID. When COVID came out, it was very new. It had skipped from animals to humans, and so it was called novel, right? HMPV has been around for a long time. Actually, it was first discovered in early 2001. And it was actually in Europe where it was discovered. But looking at the genetics, it's been around since the early 70s. So it's not a new thing. It's even been cultured in Ghana before. So it's a respiratory virus that has been around. Now, we know that during the winter months, it peaks. Right, so it peaks in different parts of Asia and Europe and all that.
This would be due to climate change or what?
No, it's just a winter virus because it's by droplet transmission. Okay. So when people gather together and stay indoors because the weather is cold, then you have upticks in. So, and the key difference between HMPV and COVID is the fact that HMPV tends to be just a respiratory, virus. So most of the things are related to colds, coughs.
So there are no add-on symptoms.
Exactly.
Like you're not going to get...
Right. It can get complicated with an actual pneumonia. Where you're having collection of fluid within the lungs, right? But generally it stays within the lungs. It doesn't become systemic like COVID would. Okay. And where COVID was really linked with mortality, HMPV is not, right? The reason why it's picked up on the media is because, it's 5 years since COVID, right? And everybody has been very, anxious about how information comes from China about these diseases. So when pictures started going out of crowded hospitals with people wearing masks in northern China, it just sort of blew up. And people are thinking, is this going to be the new COVID or something? But the two outbreaks are very different. WHO has been very clear about the fact that it is not going to be the next pandemic, definitely. However, it's something that we should take seriously as a country. So far, 9 African countries have issued, statements on HMPV. Only one is in West Africa. The rest are in East and Southern Africa.
So let's be clear, though. You said it is not linked to mortality.
Yes.
Are you saying people don't die at all?
People usually wouldn't die. It would come in as a cold, and within 3 to 6 days, it passes away. The truth is that most of us have been exposed to HMPV before. Usually the infections are when we are under 5. So at the moment, the people who are threatened with severe disease are children under 5 and then adults over 65.
Right. Where severe would manifest as
a severe cold,
right,
a cough, a very productive cough, a reduction in the ability to breathe, so it's a pneumonia, the lungs are congested, things like that. So and a lot, there's no vaccine for it, there's no direct treatment for it, so all the treatment is supportive, and if there's an overlying pneumonia, then we treat with antibiotics.
Right. So the treatment for the condition that may erupt as a result of would be antibiotics.
Yes.
A course of.
Right. The virus itself has no treatment and has no vaccine.
Like the common cold.
Yes.
But so now, other than pneumonia, any other possible complications or
so generally, I mean, if the pneumonia goes unchecked, untreated, then you're predisposed to sepsis, and then the body organs can start shutting down, right? But generally, HMPV would tend to come in as a cold and go, right? Now, the thing about Ghana for now is the fact that, this is when children are going back to school, and these flus are going on and on. In parts of the UK, some of the hospitals have already started wearing masks, going back to COVID practices because the flu season has been a bit more aggressive than usual.
Are we there yet?
We are not there yet, but definitely something to really think about and to ensure that we're prepared, because we're going to have more colds in the nurseries, in the kindergartens, and we're going to see, more children coming into our emergency room with colds.
Now, we've been joined by Dr. Ajwa Beecham, family medicine resident at KBTH. What is a family medicine resident? Okay. Just very quickly, Ajwa, welcome. What is a Happy New Year as well to both of you. What is a happy... what is a family medicine resident?
Family medicine resident is actually a resident in training for a specific specialty.
Which would be?
What we do is that we take care of babies to end of life.
Okay.
So unlike pediatricians who take care of only babies, obstetricians who take care of pregnant women, surgeons who do surgeries, we do everything. So basically, we are the jack of all trades.
What in the UK you'd call a family practitioner?
A family, exactly.
Okay.
Or a GP.
Right.
Yeah.
Your GP, your normal GP. All right. We've been talking about HMPV. Front line, obviously, both of you are on the front line. You maybe are seeing a lot of this going on there.
She's more on the front line than
right.
me.
What's going on? What have you been seeing about HMPV?
Well, I know there's an outbreak in China, but truth be told, I haven't gathered my facts right, so I won't be in a position to give you more information on that. I'm sorry.
Dr. Totimeh is talking about the simple fact that maybe we're not at the point of emergency yet.
Exactly.
But are we, though, thinking about reverting to COVID habits in terms of...
Possibly.
At least the face mask.
Right. I think, the UK did that only because in this flu season, they've gotten higher, numbers of people who came in with the flu.
And for them, it would be far more, because of the cold and everything.
Exactly.
Right.
We haven't gotten to that stage yet. However, like we said, now the world is a global village. And when one country is coughing, you should have a cold or something or the other way around.
Right.
And so it's just something to think about. And to say that, 9 African countries have already said something.
Right.
So I'm sure at one point it's something that we would have to look at and decide on. But the key reason why we're having this conversation should be that, first of all, this is not a COVID. Right. It's not a new COVID. It's a virus that's been around for a long time that we know has been studied and we know a lot about, and we are not at the stage where it's going to cause a pandemic.
Not yet.
Not yet.
And even if it is, mortality is a distant problem of a lack of diagnosis or attention, particularly in older people, you say.
Right.
All right, I'm an older person, so I'm very concerned right now. Frontline, family medicine. What are you seeing, though, in terms of things or situations that might be leading towards a problem where you're working, even at Kolebu?
Okay, so let's start with logistics. I mean, as frontliners, most of us have lack of resources to protect ourselves. And we being at the point where we are in contact with patients, either coughing, have a flu or things like that, if we are not protected and we stand at the point of spreading it, because I come into contact with a patient who has a flu, who is coughing, I don't have a face mask, I don't have a face shield, I come into contact with it and I attend to the next patient, because you find yourself in a facility where you have about 30 patients seeking your attention. Sometimes you don't have the chance to wash your hands or sanitize, before you attend to the next patient, before you realize the health person is the one spreading it. Yes, and typically Africans have this mentality or culture of not protecting ourselves. If you know you have a cough, you wear a face mask. If you know you have a cough, you carry a handkerchief around, But, I mean, we are like, manenko. We just go about coughing into each other's face by heart, spitting around. I find a lot of patients coming to the hospital just spitting around. And I think one time I just prompted one lady, hey, you don't do this here,
Have we gotten really bad and lost all of our COVID habits?
Well, it's interesting we're talking about respiratory virus now, because for 2 to 3 years after COVID, all the respiratory virus basically just went down, simply because we're masking, we're washing our hands, we're using sanitizers. And as we have, become more brave, the respiratory syncytial viruses are back. And the HMPV thing happening is just a reminder that, some of these practices were good for all viruses, and we might have to think about, going back to some of them. Definitely washing our hands, definitely using sanitizers, maybe not to the mask part, but for those of us in high-risk environments, we might be thinking about it. I know that these numbers are being followed by various research institutions in the country at the moment, and it's being studied. I do know there are people who are actually looking at the problem, and I'm sure when it becomes concerning, instructions and directions will come out.
Well, I'm reassured to know that there's somebody who's studying this, because along with the somebody's making rude sounds at me, along with the, of course, the uptick in as we hear about in other parts of the world, such as Northern Europe and China. I mean, anecdotally, just here in Accra, we have heard, apart from the cholera thing, the outbreaks in eastern western region and even in Greater Accra, but also there has seemed to be an uptick in people reporting respiratory unease. I mean, I've had this long-lasting cough, cold thing. Various other colleagues in here have done. Is there any initial research to suggest, perhaps if I can ask Dr. Beecham first, in perhaps particularly in dealing with children, there seem to have been a few outbreaks, people here anecdotally again at work talking about picking up bugs from their children and ending up with swollen glands, sore throats, coughs that refuse to go away. They're a little bit stubborn. Is this something to be particularly worried about, or would you just suggest the commonsensical things to ease the problem, and what are the commonsensical measures to ensure that the risk of infection is minimized, or if you do get a cold, you treat it efficiently?
Okay, so the first thing to recognize is that if you have a cold, you should recognize that you have such. If you have a cough, you should recognize that you have such. For that matter, you should seek a medical expert's advice. Most kids, I get a lot of nursing mothers call asking for advice on WhatsApp. What should I do? My daughter has a cough, has a flu, and just like that, they want you to send them text a medication WhatsApp for them to go and buy. It doesn't work like that.
Give me some antibiotics.
Exactly. Not every cough or flu needs antibiotics. So what you have to do, how we can abate this, is that if your child has a cough or a flu, just walk to the hospital. The child has to be assessed. As you said, sometimes they have swollen glands and all that, and they have to be assessed. And whatever necessary measures has to be put in place will be put in place. But in the home, what you can do as a mother, or as a father, or as a caretaker of a child, you can practice personal hygiene. Wash your hands when you handle your child who has a cough or a flu, so that you don't transmit it to the next child. If the child putting barriers in the house, to make your other kids safe, even at home.
So you're talking about isolating a child,
isolating it to some extent.
If they have symptoms of something.
Exactly, because you don't know what it is, and then you walk the child to the hospital for proper assessments, and then based on what research says about whatever is found your child has, we put in place the necessary measures, and then the kid is fine.
Seems like the done thing, but there is a sort of tendency to assume that when something is very widespread, as you say, we all lapse into this thing of, everybody's got it and we're all suffering from it, so you might as well go out there. Is that the way on a public health level it works? If something is widespread enough in the system, do you not need to worry about it? You can just assume that it will work its way through the population and eventually go away when weather conditions change, or do you actually have to be a bit more cautious about conditions than that?
Well, there's something we call Dr. Totimeh will help you with the word immunity. How do you call it? Herd immunity?
Right.
Yeah. When the entire community is catching a particular infection, we all get exposed, and we all battle it together. But because you don't know whether we have gotten to that herd immunity state yet, go to the hospital.
You're still going to have to deal with it as an individual case by case, as we build the herd immunity of which
let a public health unit come out to tell us that we have gotten to that stage of herd immunity.
Right.
Until then, you don't assume.
Okay. HMPV is not a killer disease. Panic not, says Dr. Totimeh this morning. However, recognize and understand that you can take steps to minimize the problems and also confront it before it gets out of hand. Preventive steps. We talked about hand washing, avoiding close contact, covering the mouth and nose if you've got a cough or sneezing anyway, and possibly disinfecting certain areas of your home on a regular basis, and to protect vulnerable groups, including myself, the elderly. Do the right thing. Don't come near me when you're sick. That's all. Doc, before we let you go, doctors, sorry, there's a conference coming up, pretty big event. Nanea will be very happy about this event because
it's the Medical Women's Conference.
The conference of the Medical Women's Association of Ghana, championing the health of women to secure the wealth of the nation. The role of lady doctors.
Right.
Dun, dun, dun. What's going on?
Thank you very much. So let me just say something small about the Medical Women Association.
Please feel free. Say something big.
So we fall under the bigger umbrella of Medical Women Association International. And here in Ghana, our association is called the Medical Women Association of Ghana. And we are, as you hear, women. We are the women aspect of the medical doctors fraternity. I don't know if we have the male Medical Male Association of Ghana. The girl child is always putting in measures to equip herself, to educate herself and all that. I don't know why the male child.
Because we are fine.
You are fine.
We
have very poor health-seeking behaviors.
We haven't sought any help. Just leave us alone.
Yes. So the conference is happening on the 17th and 18th of January. That is just this next weekend at the Family Health University. It was previously Family Health College. Now it's Family Health University.
Yeah, why are you doing it? Why are you doing it?
We are doing it because as female doctors, we find ourselves in situations where we are stressed out a lot of the times, female doctors are mothers, they are wives, they are caretakers, they are doctors as well. So we find ourselves stressed out a lot of times. And we also find ourselves in situations where doctors are posted to secluded regions and all that. We don't find time to see ourselves, to say hello and chit chat with each other. So the triennial conference is actually time for female doctors to catch up, Let's
So whilst you're catching up, who's treating the patient?
Hey,
the males are treating the patients.
No, I'm just asking.
The men are treating the patients, They don't want to have fun, so we will have fun and, distress for them. So, the conference is in 2 parts. We have the poolside cocktail. I'm so excited about this. Yeah.
poolside cocktail.
Right.
Yeah.
That sort of conference.
Yes. And we have a whole lineup of activities on that day. The program is starting at 5 o'clock to 9-ish. And we have an instructor coming to teach us basic steps in salsa,
Okay,
shake your body,
fine. So this is nothing medical at all about this.
No, nothing medical.
very
The
medical.
second
Yeah,
day,
Martina,
No husbands.
Full side.
no husbands.
Full side, no husbands, salsa. So far, that's what
Salsa.
I've heard. What else? What medical part is there?
The second day has a bit of medical aspect in it, but let's focus on the first day.
Okay.
It's a day to distress, You want to distress, and then charge ourselves up for the main conference. So we have a salsa session, and then we have electric dance moves.
Sure.
Yes.
It's getting worse as you go on.
Yeah. Yes. We're going to have a lot of games, pick and act, charades, and all that, Karaoke.
Dr. Teddy's having a fit.
Yes. And on that day, we are going to touch an aspect about our mental health as
Professional, as professionals.
Yes, as professionals.
All
So
right.
we have a lady doctor coming in to touch on our mental health because, we need to protect it. And basically what we are doing on that day is protecting our mental health. Sorry.
Right. Now, this is a national conference, let's be clear.
Yes, this
So
is
you're expecting the female doctors from across the country.
across the country. For Medical Women's Association, we have reps in the Volta region, Greater Accra, Kumasi, everywhere. So all the reps and their doctors are bringing their people on board.
Right.
As I said, it's a time for us to catch up and chit chat. So we are all coming
So
together.
you're able to share some of your experiences as well.
Yes,
and
we
some of your
will.
challenges.
Yes,
All
we
right.
will do that.
So when you're mentally stable again after the first day,
Mm-hmm.
after seeking psychiatric help, on the second day, what do you do?
On the second day, we are going to have a conference, and a theme for the conference is championing the health of the woman
Right.
to secure the wealth of the nation. And this should be the role of the lady doctor, because we find ourselves in positions where we can talk to you about your mental health and the things we need to put in place to make you whole, So we want to champion every woman, lady doctor, who would come there to go out there and also champion every other single woman she comes into contact with. Because, as doctors, we find ourselves doing a lot of things, and sometimes you break down, So you want to come and learn all these things and then go back and then champion other women as well.
Right.
We are so excited to have the first ever female vice president, of Ghana being a woman. And we are so happy about it, because now women are finding themselves in positions where ordinarily you wouldn't think a female could go there,
Where? I don't
Now
know.
we have a female vice president.
What news have you
She
talking about?
just
The
is.
We
news?
have a female vice president.
No, I didn't know.
And it's so exciting. We are so happy to
the
hear
second
that.
day is a conference.
It's a conference.
and this is the overarching theme is about championing,
Exactly.
so that you can go and deal with women in the communities.
Exactly, to
Right.
to better themselves and also to champion other women as well. And aside that, we are going to have a talk on, weight management and dieting. For postpartum mothers, we find it very difficult to manage our weight. We have an expert coming in to teach us, how to apportion your meals to bounce back.
All you have to do is walk in the morning.
To bounce back. We also have
don't know
a
what this is
session
about.
by a finance person to talk to us about money moves for women.
Okay.
We need to get the keys.
Managing your finances.
Money, yes.
Okay.
Yes, money moves for
All right.
women. Yeah.
Healing with the mother's heart.
Healing with the mother's heart.
Yes.
That is more.
Championing the health of women. This
right.
conference aims to secure the wealth of Ghana through a healthier, more empowered population.
Absolutely.
Right. Okay. Well, we're proud of you.
Thank
Even
you.
if we don't say it every time we see you.
We know.
If we say it too often, you become big-headed.
Oh.
So we won't. But we're proud of you.
Thank you very much.
Female doctors, you obviously, there's challenges that men don't face, obviously. We know this. We may tease you a lot, but we are proud of you.
Thank you.
When's the date of this event?
17th and 18th of January 2025. That's
next weekend.
Yes.
And doctors from around the country will be assembling where?
At the Family Health University at Tishi, 5 p.m. to 9 p.m. on Friday, and then 9:30 to about 4:30 p.m.
Right.
on Saturday.
Right. So they'll dance, they'll eat,
Tell
and
me
then
about
they'll
it.
have a psychiatric session.
Tell me about it.
To reset their brains. And then, God willing, they'll be able to attend the conference the following day
Yes,
and learn how to champion women
that's right.
and champion each other.
That's right.
Good luck with it.
Thank you very
And, Godspeed. And hope that it works out. And you get to meet a lot of new friends
That's
as well.
right. That's right.
Doc,
That's right.
looks
Yes,
like you're
sir.
not invited.
Unfortunately.
Do you have a similar
I'm happy
event?
to publicize. It's okay.
Do you have a similar event just before we go? Do you have a similar thing for
For
doctors?
neurosurgeons, yes.
Neurosurgeons?
Yes.
But there's only about 4 of you. Well, I mean, what are
No,
you
there are
talking about?
26 of us.
My guy.
Yeah.
4. So where do you can meet in somebody's house?
So we have a neurosurgeons conference coming up in 2 weeks' time.
See, there's
You
only
know,
20-something of you. You're having a conference. You can meet in somebody's garden.
It's in a hotel.
Oh, wow.
So
They
Okay.
do things with stuff.
we'll do some mental health stuff in there.
You do some dancing and mental health as well. I would say thanks to both of you for your education this morning. We've had in the studio, who have we had? Dr. Teddy Totimeh, consultant neurosurgeon, and Dr. Ajwa N. Beecham, a happy family medicine resident at KBTH. Thank you so much for your time this morning and for the education. Right, that's it. That's a wrap from the Asaase Breakfast Show today. Xtra is here somewhere. Ania is here doing affirmative action everywhere. And my name is Kojo Mensah. We'll be back tomorrow morning. Same time. Make it 8. Don't be late. Coming up next, Abutiate says he wants to deliver the news at the top of the hour.